Greetings of the day, dear students. This session is for the GNM nursing first year students. The topic is first aid management of hanging and falls. So in today's session I will discuss about falls and hanging. What are the falls, what is hanging, and what are its causes, what are the signs and symptoms, and how to do first aid management of the hanging and the falls. So first we will discuss about falls. I think all of you know what are falls. Most commonly these are seen in all age groups. That is, even the small child, an infant, toddler, adolescent, teenager, or adult person, or a old or elderly person. Falls are seen in all age groups, right? And they vary from few injury to broken bones and even death. So depending upon the severity, it can cause severe disease condition. For example, there may be any small wound like laceration, there may be open wound, or there may be fracture, or the even it may be so serious that the person may be dead because of fall only. So, what are the causes? 66% of all the falls result from the slips or the trips, and 34% result from the heights. So, be aware of slips, trips, and the falls. 66% because of slips and trips, and falls constitute about 33%. Now, why the slips occur? Because of any weather changes. For example, in the rainy season, slips most commonly occurs, or hazards like home hazards, like there may be any banana peel which is in the floor, or there may be any spill, like liquid spill, water spill, tea spill, then loose rugs or the mats, then any working surface which can be wet or oily. Now trips can occur if there is a collision between the foot and the object, or a view is very obstructed, or there may be poor lighting. Then the carpets may be wrinkled or the slippery. The steps may be uneven, the person is not taking steps correctly, maybe because of alcoholism. Then during the capture of pictures in the camera or the mobile. Now fall from height can happen accidentally, or the person can jump intentionally. There may be a parachute accident, suicidal attempts, or defenestration, means other person throw away the other person from the height, or it may be just a forceful attempt to throw away the other person. Now, who are the high risk victims who are prone to fall? Age. According to the age, elderly and the infant who are unable to take care of themselves, right? They are responsible or more prone for fall. Then footwear are of inappropriate size, or the persons are working in the heights, like those persons, construction workers who are building, who are making the buildings, or who are working in the electrical poles. So these are the victims who are more prone for fall. Now first aid. If the person has fall, what should be the first aid management? First, check and monitor the level of consciousness. This is very important because after a fall the person become unconscious, right? So check and monitor the level of consciousness. Then check the pulse rate, airway, and the breathing, CAP, CAB, circulation, airway, breathing. If required, start the CPR. And there may be chances that person may go into shock. It can be any shock. So prevent and reduce the risk of shock. Cover the victim with a coach or blanket so that the heat loss can be minimized and the complications arise due to shock can be prevented. Then examine the victim physically for the signs of wound and fracture, right? When the person has fallen, so this is important, you have to check for the signs of wound and fracture. According to it, you have to provide the first aid. If you found that there are no any injuries and the victim is breathing normally, then place the victim in a recovery position. Then shift the victim to the hospital as early as possible. Now hanging. We will discuss hanging, strangling and the throttling. What is hanging? It is suspension of the body by a noose around the neck. Most commonly ceiling fans or trees are used for suspension of the body. Then strangling means constriction around the neck by using any rope, any string, any dupatta. Then throttling is squeezing the throat. It is done intentionally, and there may be use of hands and the fingers for squeezing the throat. So a condition when a person strangulates himself or herself with a piece of cloth, rope, string in order to end his or her life is called hanging or strangulation. Commonly ceiling fans and the trees are used. Now what are the causes? It may be a murder attempt, or there may be any suicidal attempt by the other person. It can be any accidental for those who are working in the working or in come in close contact with the machines. Then manual choking means other person is using the hands and the fingers, or the same person is using the hands and the fingers for strangulation or throttling. Then postural asphyxia. This is a form of asphyxia which occurs when someone's position prevents the person from breathing adequately. So this may also be a cause of the strangulation, in which position is preventing the person from breathing normally. Now what can be the sign and symptom? There may be any constricting object around the neck like dupatta, rope, string, cloth. There may be marks on or around the neck. The face may be congested. The consciousness can be impaired. There may be cyanosis or the death. Now what is a first aid? Immediately remove the constriction from around the neck because it is interfering with the breathing of the person. So immediately you need to remove that constriction. Then if the body is still hanging, you have to support it. Then if there are chances of spinal injury, do not move the victim unnecessarily because this will further damage the spinal cord and deteriorate the patient's condition. And then call for the emergency services. Do not destroy or interfere with the material on the spot because this will be helping in collecting the evidence, because this will be considered may be considered as a medical legal case. Then lay the casualty on the floor, check for manual choking, check the cap and provide the CPR as required. So in today's session, we discuss about the falls and the hanging and what is the first aid management of these. Thank you so much.